Faith healing is the attempt to use religious or spiritual means, such as prayer, mental practices, spiritual insights, or other techniques to prevent illness, cure disease, or improve health. It is believed by many that faith can not only make a person mentally healthier, but can also cure physical ailments and alter the world around us. Faith healing comes in many forms, such as the belief in a healing God, meditation, prayer for oneself, or prayer for others. Faith healing, otherwise known as spiritual healing, was first documented in Greek and Roman cultures, yet is still being used and studied today. With each religion and set of beliefs, faith healing takes on a different form. For example, Christians believe that prayer can cure ailments and cause healing and well-being. One prays to God and their prayers are answered. Buddhist religions take a different view. In Buddhist traditions, meditation is a way for a person to get to know their inner selves, and thus are able to have a healthy connection between their mind, bodies, and spirits. Not only can faith healing help one person, but recent studies show that praying for large groups of people can have a positive effect on their outcomes. Faith healing comes in many different forms, yet none is more important than the other. There are many reasons for people to feel skeptical about using faith to heal. In our current age of high technology and innovative medicine, it is hard to understand a concept of something as simple as faith. However, still today, faith healing is frequently used to help cure the mental and physical ailments of people around the world. Faith healing can first be witnessed in pre-axial age Greek and Roman cultures. Asclepius, the god of medicine and healing, is the first known example of a spiritual healer in history. According to Greek mythology, in 300 BCE, a cult emerged that centered on the belief in the god of healing. The people believed that Asclepius would visit them during their dreams, and that the priests could then interpret these dreams and recommend a remedy for their cure. Many people came to visit the shrines of Asclepius to find cures for all that ailed them. The Old Testament of the Bible also contains a few examples of faith healing. However, one story of faith healing is told in Kings vs. Naaman, where a Syrian general is stricken with leprosy and is advised that the prophet Elisha could cure him. Naaman follows orders to go to him and requests to be cured. Elisha advises Naaman to bathe 7 times in the Jordan River, and that he would be cured. As a result, Naaman was completely restored to health. The New Testament also contains hundreds of examples of faith healing. Most of these stories are shown through the stories of Jesus. Jesus, who was known as a miracle worker, was famous for his ability to heal people using miracles and faith. Jesus' first documented use of miracles to heal is seen in the book of John. In this miracle, a nobleman from Capernaum asks for Jesus' intervention on behalf of his dying son. This worried father journeys to Cana to seek the help of a proven performer of miracles whose fame was rapidly spreading. And Jesus obliged, seeing his faith. The Bible goes on to tell many examples of Jesus' ability to heal through the miracles that he performs. Though the history of faith healing often concentrates on the healing of people by gods and prophets, it is not uncommon for faith healing to work in other miraculous ways. As believed by many Indian religions, meditation is the only way to cure your mind and body from its ailments. Meditation is largely concerned with having awareness and is much different from worship and prayer. Meditation is a self-directed practice for relaxing the body and calming the mind. Most meditative techniques have come to the West from Eastern religious practices, particularly found in India, China, and Japan, but can be found in all cultures of the world. Until recently, the primary purpose of meditation has been religious, although its health benefits have long been recognized. It is now being further explored as a way of reducing stress on both the mind and on the body. The word meditation is derived from 2 Latin words, meditare, which means to think, dwell upon, and to exercise the mind, and Madiri, meaning to heal. Its Sanskrit derivation, metta, means wisdom. Meditation is also seen as a natural way to get to know yourself, and it is believed that the better connection a person has with themselves, the healthier they will be. Meditation has proven to have many positive effects on the mind and the body, many of which aid in healing physical and mental illnesses. People who meditate put their body into a deep rest-like state, meaning that during meditation they have a decreased metabolic rate, a lower heart rate, and have a reduced workload of the heart. It has been proven that people who meditate have lower levels of cortisol and lactate, which are two chemicals in the brain that are associated with stress. Meditation also aids in the reduction of free radicals, unstable oxygen molecules that can cause tissue damage. They are now thought to be a major factor in aging and many diseases. Meditation can also cause a decrease in high blood pressure and drops in cholesterol levels. High cholesterol is associated with cardiovascular disease. People who practice meditation also gain improved flow of air to the lungs, resulting in easier breathing. This has been very helpful to asthma patients. These physical benefits of meditation are clearly shown. However, meditation helps cure not only the body, but also the mind. Meditation has also been shown to have positive emotional effects on those who practice. Meditation causes a person to have increased brainwave coherence. This brainwave activity is associated with greater creativity, improved moral reasoning, and a higher IQ. Practicing meditation has also been proven to decrease anxiety, depression, irritability, and moodiness. It is also associated with improvements in learning ability, memory, self-actualization, happiness, emotional stability, and increased feelings of vitality and rejuvenation. Each of these leads to a person being overall happier and healthier. When a person learns how to meditate and begins to learn how to connect their mind and their body, they are able to control their body in new ways. They are able to stay healthier and even cure themselves of illnesses that they may receive. Meditation is one form of faith healing that has been scientifically studied and proven to be beneficial to health and well-being. The act of meditation is beneficial not only to the body, but also to the mind. Meditation is not the only way to practice faith healing. Some faith healing works in more mysterious ways. Faith healing can also be shown through prayer. Prayer allows people to ask for help with their ailments and problems from a higher power, such as God. It cannot be said whether the act of praying, or faith in general, is what causes the healing to occur. But tests have shown that people who pray are more likely to recover from a physical or mental illness. A subject like faith healing is very hard to prove on a scientific basis, because most of the people who are performing the studies have a faith of their own, which can cause these studies to be biased. However, many studies are now being done as double-blind experiments, which means that neither the researchers nor the participants know which position they have in the study. These types of research are allowing the effects of prayer on healing and well-being to be better proven on a scientific basis. People who believe in organized religion are physically healthier and live longer than those who are not spiritual. Recently, there have been many scientific studies done about the effects of prayer on healing. In one controversial study carried out by cardiologist Randolph Bird, nearly 400 heart patients were randomly assigned to either a group that was prayed for by a home prayer group or to a control group. This was a methodologically rigorous double-blind study designed to eliminate the psychological placebo effect. In such a study, neither the patient nor the doctor knows who is receiving the intervention, in this case, prayer. Patients who received prayer had better health outcomes, including a reduced need for antibiotics and a lower incidence of pulmonary edema. This study showed very clearly that prayer had a positive effect on those that were prayed for. Although it is unknown how prayer may work, studies like this one show that there actually may be some scientific evidence that can be used to promote faith healing.